How to take care of your heart, 6 healthy habits. Habit 1. Regular physical activity. First of all, it is worth getting into the habit of regular physical activity. This can be moderate exercise, for example, fast walking at a speed of about 5 km per hour, cycling at a speed of less than 16 km per hour, water aerobics, from 2.5 hours a week with a gradual increase to 5 hours. Alternatively, for those with less free time, experts recommend intensive aerobic exercise for 75 minutes to 2.5 hours a week, running, swimming, or cycling at more than 16 km/h. Moderate and intensive physical activity can also be combined. At the same time, it is more correct to distribute the training evenly during the week. You should not forget about muscle strengthening. It can be, for example, lifting weights, push UPS, pull UPS, exercises with an extension cord, climbing in closed spaces or tug of war. You should do such exercises at least twice a week. Habit 2. Control your body weight and waist circumference. By periodically weighing yourself, you can timely detect an important cardiovascular risk factor, elevated body mass index, BMI. The second such factor is an increased waist circumference. You can calculate BMI with a calculator. Normal BMI is 20 to 25, and waist circumference is less than 94 centimeters in men and less than 80 centimeters in women. Habit 3. Life without smoking. Smoking is responsible for 10% of all deaths from cardiovascular causes. On average, this habit shortens life by 10 years. You can assess the degree of nicotine addiction with the Fagerstrom test. Do not hesitate to ask your doctor for help to stop smoking. In severe addiction, medication therapy may be required. Habit 4. Healthy eating. Do not salt your food. Daily intake of salt should not exceed 5 teaspoon without a slide, including table salt added during cooking, and that already contained in ready-made products. Food may seem unusual at first, but you will soon be able to enjoy the true flavor of the food. Eat more fruits and vegetables, at least 400 g or 5 servings of fruit and at least 400 g of cooked or fresh vegetables a day. 1 serving is 1 large fruit, such as an apple or orange, or 2 small fruits, such as plums or kiwi. This healthy habit will allow you to get the necessary amount of dietary fiber, at least 30 grams per day. Fruits, pears, apples, oranges, peaches, berries, raspberries, strawberries, blueberries, vegetables, cauliflower, broccoli, green beans, and legumes, peas, lentils, beans, are rich in dietary fiber. Give preference to fish and poultry without skin and lean red meat without layers of fat. Fish should be included in the menu once or twice a week, and on one of the days, fatty, mackerel, sardines, salmon, mackerel, herring, halibut. Limit saturated fatty acids, such as vegetable oil. They should make up no more than 10% of your total caloric intake. Doctors recommend not consuming more than 1 teaspoon of olive oil per day. To prevent atherosclerosis, choose only soft margarine, available in tubes, spread margarine, and plastic boxes, low in saturated fat and low in GI trans isomers, less than 1%. Also helpful is the habit of eating 30 grams of unsalted nuts a day, except peanuts, which are actually a legume. Habit 5. Limiting alcohol consumption. To preserve the health of the heart and not only, doctors recommend limiting alcohol consumption. So, the maximum daily amount is just under 2 small glasses of wine, each about 100 ml, 2 bottles of beer, each about 0.33 L, or 2 shots of vodka, 30 ml each, for men and half that for women. If you cannot limit yourself to this amount, it is better to refrain from taking alcohol. Habit 6. Regular preventive check UPS. It is especially important to see a doctor for those with a family history of early cardiovascular disease, hypercholesterolemia, high cholesterol, as well as other risk factors, smoking, high blood pressure, diabetes, or high levels of bad cholesterol. If the risk is close to the threshold, meaning that treatment may be needed, cardiovascular exams should be done every 5 years. Men under age 40 and women under age 50 without cardiovascular risk factors may not think about regular checkups.